Hi, everyone. My name is Stephanie Flowers. I am a community health worker with Virginia Department of Health, and I'm also on the COVID education support team. I am joined by Stephanie Tony, who is our coordinator, and we are excited to be here today. We were having a little bit of technical difficulties. That's why my camera is off. I do apologize. So I'm glad that you all are here today. Hopefully I will say something that helps you out. We're going to talk about COVID-19 vaccine and what you need to know. So we're just going to do like a quick poll question, pre-poll question. And if you can just put in the chat whether it's A, B, or C. Are you planning on getting the COVID vaccine? Yes. Maybe, but I need more information. No, however, I will share reliable information with others. If you can just like blow the chat up with like, or you can answer the poll question. Thank you, Stephanie.
I got your back, Stephanie. I got you.
Thank you so much. Thank you. So if you can answer the poll question for me, just to let me know kind of where you are in the process of getting the vaccine. All right. So most people answered C. Okay. Hopefully I will say something today and you'll see some information that will help to address your hesitancy so we can move forward. Next slide. All right. If you are planning on getting vaccinated, which vaccine would you prefer? Johnson & Johnson, Pfizer, Moderna, or thankfully have already been vaccinated? If you can answer that question for me, that would be appreciated. And if you can just shoot it, if our poll is not up, here we are. If you are not vaccinated yet, which vaccine do you prefer? Someone put none of the above. Okay. All right, we'll give it a couple of more seconds and then we will proceed. All right. Wow, 100% said I've already been vaccinated. Okay, good job. All right, you can move forward. Where are we now with the COVID vaccine? So worldwide, there have been several vaccines that have been in process. However, for the sake of this presentation, we are going to talk about the three main that have been approved for emergency use in the United States. And as of last week, the Pfizer vaccine has been FDA approved. So we're excited about that. So the three that have been approved for emergency use are the Pfizer-BioNTech, the Moderna, and the Johnson & Johnson. Like I said earlier, the vaccine that has been fully authorized in the United States as of last week has been the Pfizer. So how does the COVID vaccine work? So there are several different types of approaches that scientists took to develop our COVID-19 vaccines. However, for the sake of this, we're going to talk about DNA and RNA approach, which are the Pfizer and Moderna, and the viral vector approach, which is the Johnson & Johnson. You cannot get the COVID-19 virus from the COVID-19 vaccine. The three vaccines have been authorized and do not contain any live or inactivated virus. There is no risk of becoming infected with the COVID-19 vaccine. So for the purpose of this slide, what's mainly important is the time between doses and the dosage amounts. So for the Pfizer, that is a 2-dose series. The Moderna is also a 2-dose series, and the Johnson & Johnson, also known as the J&J, is a 1-dose vaccine. So how quickly did we make this vaccine? That's a question a lot of people ask. Actually, scientists were already in the works because of SARS and MERS and a couple of other CoV-2 that have been out previously. They already had COVID-19 vaccine in the works. And so, with that being said, we live in one of the greatest countries, the United States. And so we have money. So we were able to, unlike a lot of other countries, we were able to manufacture this fairly quickly because we already had COVID in the works due to vaccines and viruses that were already out. So that's how we were able to do it. You can advance this slide for me. Thank you. So the mRNA vaccines, which are the Pfizer and Moderna, have 95% efficacy, and the J&J has 72% efficacy. All three vaccines have shown incredible efficacy in the United States, and the result of all three of them is the same: protecting you from serious illness, hospitalization, and death. Is the vaccine safe? Yes, the vaccine has been safety. We've had safety monitoring with our COVID vaccines throughout. So every time someone gets the COVID vaccine, they're monitored, and it's kept in a monitoring safety database. And so that's how we're able to keep abreast with new symptoms that arise. And so, yes, it's safe. You could advance this slide for me. Thank you. Okay, who can get the vaccine? You can advance this one as well. So as of right now, who is eligible for the vaccine is everyone over the age of 12 and older. At first, we were vaccinating our most vulnerable populations, but now everyone is eligible for the vaccine. Vaccinating kids 12 to 17 you need to have a consent from a parent or legal guardian. And to find out where you can get vaccinated for your children, you can go to vax.rchd.com, or you can call our call center at 804-205-3501. We also have several walk-up clinics that RCH is doing. And so there are many ways that you can get vaccinated, not just with VDH events. You can go to your local pediatrician. You can go to CVS and Walgreens. We have several different resources where you can get yourself and your family, your kids vaccinated. You can advance this slide for me. Thank you. So as of current, in the state of Virginia, we have vaccinated well over 9 million of our Virginians. And as quickly as they're coming in, we are giving them out. Right here in our locale, in our local Richmond and Henrico health districts, we have administered over 588,000 doses as of August the 24th. 67.1% of Richmond and Henrico adults have had at least one dose. 60.4% of Richmond and Henrico residents are fully vaccinated. So how do I get vaccinated? Like I said, now we are vaccinating the general population, which is phase 2. And so, like I said, you don't need an appointment as of now. You can go to any walk-up clinic. You can go to Walgreens, CVS. They are one of our big partners. You can also go to vax.richmond.rchd.com, or you can call our call center at 804-205-3501. You can also go to vaccines.gov to find out where where we're offering the vaccine closest to your home. So although we're getting vaccinated, we also want to continue with best practices. And some of those include just if you're feeling sick, stay at home. Just continue to social distance while you're out. Continue to wash your hands and continue to wear your mask in public. How do I learn more about the COVID-19 vaccine? So there are a lot of resources out there. My recommendation is that you stay abreast with the most reputable resources. And some of those are your local health district, whether that be Richmond or Henrico, whether that be Chesterfield or Hanover, the Virginia Department of Health as a whole, CDC, the New York Times, NPR, and VCU. These are just to name a few, but these are reputable resources that are updating on a daily basis. Sometimes the VDH is updating more often than that. So these are just a couple of resources that you can pull from to get valuable and up close and personal and resourceful information. So why should I get the COVID-19 vaccine? Because it's effective, because it's safe, because it's free, and because ending the pandemic depends on most of us getting vaccinated and hitting herd immunity. And because the rest of us need you to stay as healthy as possible. And also because the COVID-19 vaccine fights more than just a virus. That's Dr. Fauci, y'all. You can, yes. So we had a presentation poll. So now we're going to do a post-presentation poll. We just want to know, based on the information that you were given, are you planning on getting the vaccine for those who have not? Yes, maybe, but I need more information. Or your answer may still be no. And hopefully we can do a quick Q&A session, and I can help to address any hesitancy questions that we may have. So I'll give you a couple of minutes just to answer the poll question. Oh, wow, 100% says, thankfully, I have already been vaccinated. Yay! All right. Are there any questions for me? Thank you all for joining us today. Are there any questions?
Hey, Stephanie, this is Jana, and I have a question.
Okay.
Similar to not the vaccine, but just around COVID testing in general. I know that the health department does 1 or 2 a week, but do we anticipate more testing events becoming available in the coming weeks? Yes,
we're going to start little testing hub cubicles in different locations. And we are in the process of getting those together. And so I will send you a list. We should have those together this week because we've been having a lot of meetings. And so I will get that list to you of where we will be set up weekly. Yes, ma'am.
That would be, great. We had to get my daughter tested recently, and it was very difficult to find a testing site.
Yes, ma'am. Yes, ma'am. Yep. We are working on that, and we will have that this week.
Perfect.
Yes, ma'am. Any more questions?
Yeah, please feel free to throw a question in the chat box or come off mute.
So someone said in the chat, you stated that COVID vac protects you from more than just COVID. Can you elaborate? Yes, ma'am. So basically what that is saying is it protects you from more than just COVID. And it protects us from just being able to, or not being able to get back to normal life. And so things will never be as normal as they were. I mean, I just recently lost my mom and my uncle to COVID. And so things will never be like they were before, especially in my household. However, but it would get us back to some type of normalcy. So that slide wasn't necessarily for like other diseases and other vaccines. It was more so it protects us from just staying in this state that we're in, and we can kind of get back to some type of normalcy. Did that answer your question? I hope that answered. Do you have any definite knowledge on contracting and spreading even when vaccinated? Wow. So this is something that has come up. And so what we have not, and this is CDC, so I'm speaking from what I have gotten from them. What we have not been able to prove is whether or not, if you are vaccinated, whether or not you can still contract and pass it along. Now, what I have seen is people who have gotten vaccinated. There are people who have still been able to get COVID-19 after being vaccinated. There's several reasons for that. Number one, as you guys know, I'm gonna go ahead and address this because I know this question is going to come up. As you guys know, there is a booster shot that will be available hopefully by the end of September. And then there's something that's out that what is called the third shot. The third shot is for immunocompromised people, like people who have cancer and people who are going through chemo, and people who have like immunocompromised issues. And so those people are able to immediately get a third dose just to boost their immunity. That is completely different from the booster shot that are going to be available for Pfizer and Moderna. And so I have seen people, so to answer your question, I have seen people who have been vaccinated, yes, still get COVID-19. One of the reasons why they're coming out with the booster is because it appears that 8 months after you have gotten vaccinated, you need a booster shot to keep you from contracting COVID-19 and getting seriously sick and put in the hospital and possibly dying. So I've seen people who have gotten it like in January, February, now that they have got COVID-19, it's because they need another booster shot, just to keep it up. And so I think that that's going to be something that we get. We don't know the numbers whether it would be 6 months or 8 months. CDC doesn't even have that. They're just saying several months after. They're not giving a definite number because they don't know. That's one thing about COVID-19 and this thing. We are living through this in real time. You know what I'm saying? And so every day there's something new, and it's because we're living through this real time. I mean, I'm 39 years old. I'll be 40 in October. This is the first real pandemic that I have lived with and have lived through, and I'm still living through every day. And so, there will be questions that we can't answer, but I will tell you this, if I don't know the answer, I will get your email address, I will get the answer, and I will get it to you. And so
was also going to add, this is Stephanie Tony from the health department, that I provided a link. VDH has a dashboard all across the Commonwealth. This isn't just for our locale, but it shows you that information. And so, at a glance, with the 230 people that have gotten the considered breakthrough cases where they've been fully vaccinated, however, they still got COVID, 230 people to the 3,000, over 3,000 that are unvaccinated. And so, while it's kind of like, well, what's the point of, getting the vaccine? The answer to that would be to avoid serious illness, to avoid hospitalization, to avoid death from COVID-19. And so that's the key piece that we want people to take away, that if you get vaccinated, it really significantly helps in the way you respond to being to COVID-19 if you were to get it. And so just wanted to highlight that. information, and also bring attention in the chat that I provided a link if you wanted to get more information.
Thank you, Ms. Stephanie. Are there any more questions?
It's not a question, but just wanted to also mention that we just had another side conversation that we were having about what are the reasons most people are hesitant to get the vaccine. And one of them is, I just want to wait. And so, in talking, we do a lot of community canvassing out in the community to ask, what's your journey with COVID-19, and what's your journey with COVID-19? And so a lot of people are saying, I'm just going to wait. Maybe I'll wait till the holidays. Maybe I'll wait till, my kids can get vaccinated as well, and we'll just go as a family. Maybe I'll just wait until 2022. Maybe I'll just wait. So there's a lot of statements around waiting. Maybe not even with a definitive timeline specifically. And so anyhow, I just wanted to mention that in this space, that is something that people are choosing to do, but just, wanted to encourage as well that in order to end the pandemic, we don't want any future types of deltas happening, right? Because now we need another booster because the vaccine may not be as effective, or we might find something that's transmitting at a higher rate than others, or more contagious than previous iterations of the virus that we've seen, or variants of the virus that we've seen. So anyhow, just wanted to mention there's many people that are choosing to wait, and just encouraging them to get the information that they need to feel better about making a choice to go ahead and get vaccinated. And then, as we know, a lot of employers, I shouldn't say a lot, but some employers are moving to the place of making that a requirement or getting tested weekly. So, while we don't want to, our platform here is to provide accurate information about the vaccine and not make anyone feel pressured to get it. We also want to make sure that we're doing a good job of disseminating this information to others. So to those of you that may not be vaccinated yet, but you're still here getting this information, we are grateful that you're here and being willing to share reliable information with others so that they can make an informed decision about getting vaccinated. So just wanted to make sure I put in that plug to say thank you for being here, regardless of your vaccination status.
That's so good. That's so good. Yes, we at the health department, we're not here to pressure or convince. We're just here to provide education and to give you the best up-to-date knowledge so that you can make an informed decision for you and your family.
Any other questions from anyone else as we are, ready to wrap up? If there are no other questions, even if it's not your question, maybe you just think it may be helpful in this recording for us to answer it. We are happy to do that as well. All right. I don't see anybody coming off mute right now. So it sounds like everybody's got their questions answered. Stephanie and I, so like you guys don't have to try to remember whose name is who, right? So just Stephanie Squared have been able to provide this presentation to you today. Thank you so much for giving us your time and attention for this presentation. Stephanie Flowers, you got any other comments as we close out?
No, that's it. Thank you.
Thank you, Health Department team. We appreciate it. And with that, we will stop our recording, and thanks, everyone.